People always say, how can you do it? Isn't that so sad? That's the most common question I get from
Mhm.
other folks, even sometimes within healthcare. I always say, yeah, there's definitely sad aspects of hospice and palliative, but those patients are getting cared for and their stories are so important, right? My own practices for supporting my well-being and prioritizing that goes against a lot of the cultural norms in medicine and working in medicine. Been one of the best ways I've sustained myself is growing in my own ways. And then definitely since 2020, right, when the pandemic started and it was complete chaos at the hospital and at home with all the schools out and everything, daycare's closed. I think that's when I discovered coaching as a different way and a different tool that has honestly transformed so much for me. I remember being at a physician wellness conference. It was amazing having that time and space to talk with other women, connect, do a lot of self reflection and journaling and stuff that I was like, I'm going to do it. I'm going to become a coach. And I'm still evolving in terms of what does that look like and how does that fit in? Because there's not just extra room in your schedule. You have to create it and shift things to prioritize what is calling to you most in any season of your life.
Wonderful. Hello, everyone. My name is Dr. Moss. I am very excited to interview Dr. Sarah Wittry, who is a hospice palliative physician and certified mind body coach dedicated to empowering women physicians. As a mom of four, she balances a rich family life with her passions for yoga, books, travel, and engaging in deep conversation over a good cup of coffee. Sarah's holistic approach to well being inspires those around her to find harmony in both their personal and professional lives. Thank you for being here, Dr. Wittry.
Absolutely. Thank you so much for having me, Dr. Moss.
Thank you. I would love to learn a little bit more about you and your journey into and through medicine.
Sure. I started out in college being drawn to everything related to anatomy, but I was focused on thinking I wanted to be a pediatrician. I loved children, and I thought a good pathway to do that and was interested in hematology oncology at the time. And so, even before medical school, during college, I was volunteering for summer research programs at St. Jude Children's Hospital. That was my first experience of just like helping understand more about what patients and families are navigating as they go through the healthcare system. And then a lot of the bigger questions. So things like, how do we make sure that people are prioritizing quality of life if they have a disease that's not curable, particularly the emotional challenges in navigating that with young children and their families, right? I always thought I wanted to do a field where it was like really deeply human to human connection. And that's what drew me to it even before I went through everything. And then through many different twists and turns along the way, a lot of learning about myself. I ended up going to med school, then doing residency in physical medicine and rehab, knowing early on I wanted to do either a cancer rehab fellowship or a hospice and palliative fellowship. Yeah, I can tell you a lot about the overlap and everything that I saw and these voids I saw in our medical system that I knew I wanted to help fulfill, like in my small way, my small contribution. It's just evolved. Honestly, I feel like my personal journey and my professional journey have evolved simultaneously, if that makes sense. Not knowing exactly where I'm going even now, but knowing like what I want to focus on and how that's shaped not only what I do in my career, but what I'm doing in life and coaching and everything. So, without giving you a million details, that's an overview.
Amazing. I think that is a common thread throughout all the individuals that I've interviewed. Like you said, that personal and professional journey and how they overlap, feed off each other, and grow as we keep going in life.
Absolutely. Yeah. We're always, I think if you're committed to personal growth, personal wellness, that you're going to always be discovering new things about what you like, what you desire, and what that looks like translated into real life.
Oh, completely. I agree. It's interesting that you went from PM&R to palliative fellowship. I don't think
Yeah.
I've heard as many individuals go that route. What led you to go that way from the PM&R?
That's a good question. I think 'cause I trained in the academic center, University of Washington in Seattle. We overlapped a lot with inpatient consultative services when there would be big family meetings for patients. They would often involve the PM&R team to talk about function potential, rehab potential, these big life-changing things that happened or life-changing diagnoses. So we saw patients with brain tumors, but also patients who had just had a big traumatic event happen and they have maybe a new brain injury or a spinal cord injury or something life altering. We'd always be at the table talking with these families with the palliative care team. I was drawn to their transparency in communication, their emotional intelligence, and just ability to bring all the different specialists to the table to really break down big picture in a really compassionate manner. So I think seeing and interacting with the team over the first couple of years of residency, I was fairly certain that's what I wanted to go into and continue to develop those relationships and skills. I think it applies, like they have a lot of overlap in terms of the team environment. You're working with physical therapists, occupational therapists, social workers, all of those different interdisciplinary team. The same in palliative, like you really draw on one another's strengths, which I think has been something that I can't imagine not having. Now that I work in palliative care, we feed off of each other and each other's skill sets. It's a phenomenal way to crack the shell a little bit in some of those patients and families that are harder to understand what's going on and what it's like for them going through stuff.
Yes, I completely understand that. One of my first shadowing experiences in medical school was with palliative medicine.
Cool.
Opened the door to palliative medicine, and that's actually something that I'm interested in from the psychiatry because I'm
Yeah.
exactly with you. The emotional connection, the interprofessional collaboration, it's so important. I think we've
Yes.
actually had the opportunity. I don't know if I've posted it yet to this point, but I've had a nurse practitioner who's also in palliative.
Awesome.
Anyone wants to learn more about palliative, I think we'll also have one other physician who's in palliative. So
Oh, awesome.
there is so much warmth and compassion and just love in that field.
Yeah, people always say, how can you do it? Isn't that so sad? That's the most common question I get from
Mhm.
other folks, even sometimes within healthcare. I always say, yeah, there's definitely sad aspects, but those patients are getting cared for and their stories are so important, right? And we just don't hear as much about the person. And the reality is, like, people have medical conditions that we at some point can't cure, or like the treatments are too burdensome for them to undergo, like their quality of life is complete crap. And so just being able to be there and walk them through that, I feel is so much more meaningful and humane way to be involved than knowing that's happening and not feeling like you can, on the other side, they're not understanding all the information and making these decisions that are super challenging, maybe not feeling well supported or fully informed. And like I always say, the reality of people are going to die at some point, making that process as dignified and humane and obviously comfortable as possible, I think is, I can't imagine doing other type of work within the medical field.
Oh my goodness. Yes, I completely agree. Because so many people see it as, well, it's a heavy work. There's a lot of motion. How have you been able to not bring all that emotion and stress and pain home with you? I know that you mentioned you are a mother at the same time. How
Mhm.
do you recommend or how have you balanced that
Yeah,
experience?
I would say continual growth and evolvement of what I need. Starting out not really knowing exactly what that meant, but always having like an awareness, I think, that was going to be needed in this field, particularly. And if you approach it as a skill set you can develop, that is pretty empowering. Honestly, having my own practices for supporting my well being and prioritizing that goes against a lot of the cultural norms in medicine. Working in medicine, one of the best ways I've sustained myself is growing in my own ways. And then definitely since 2020, right when the pandemic started and it was complete chaos at the hospital and at home with all the schools out and everything, daycare's closed. It was crazy. I think that's when I discovered coaching as a different way and a different tool that has honestly transformed so much for me, just in the way that I view what is possible for myself and my life. And that sounds grandiose, but it's true. Just being able to understand and receive support from a community, which you know is really important, but you don't always practice it. I think that's been those kind of practice this for myself and then being consistently able to be supported by a community of like-minded women, professionals and working moms has been probably the biggest game changers for me in terms of how I'm able to continue to show up how I want to as a mom in my home, all different aspects of me to work and home, but there's so much integration across them now. I used to view it as like you turn one off, you turn the other on, you know?
Yeah, I hear you. That makes sense. And you mentioned coaching, and it's so interesting. It seems a common theme that I'm hearing. A lot of successful women physicians are bringing on this coaching aspect. I'm excited to hear more because, in my mind, coaching is like you yourself coaching other women. How did that come about in your life?
You mean coaching for myself
Well,
or
is it, are you
yeah.
saying you got coach and
Oh
then
yeah.
others, or how did that work?
I discovered coaching for myself, like physician coaching, and grabbed onto it like a life raft during the pandemic because things were just so unstable. It was a way that allowed me so many perspective shifts. So I feel like because I was able to experience how much things transformed for me in coaching myself, even without any situations changing. I was feeling burnt out. I was feeling exhausted initially after a few months of going through some coaching, both in the one-on-one setting and a group setting. Nothing had changed. Like I was still working full time. I still had 4 young children. I was still playing all these roles, but the way I showed up to them and the way I felt about my capacity to handle them and have more agency in my experience was vastly different. And I think when I was integrating that work, I was able to say, oh my gosh, everyone needs this, right? Not just physicians, but everyone who's balancing life needs this support. It was something I had not experienced before. I'd done a lot of therapy and self help books and podcasts and a lot of the personal development work. But coaching, I feel like, took it to very much a next level. And then once I had experienced that for myself, I was on the fence for a while. I was like, I can't be a coach. I have too many things on my plate. And then it was almost like using coaching to open up a little bit wider, exploring it and asking really good questions. A lot of what coaching is to lead you to your own answers, essentially, that are you already know, but they're all like covered up by societal expectations and things you believe are fixed, but actually aren't. And so, as I continued to explore that, I remember being at a physician wellness conference. It was last May. It was amazing having that time and space to talk with other women, connect, do a lot of self reflection and journaling and stuff. But I was like, I'm going to do it. I'm going to become a coach. That's where I announced it to other people and it made it very real and tangible. And then I think it's just a matter of from that vision, like implementing it and taking steps into making it happen. And I'm still evolving in terms of what does that look like and how does that fit in? Because there's not just extra room in your schedule. You have to create it and shift things to prioritize what is calling to you most in any season of your life. So that's where I'm at right now is figuring out how that works together and how to split my time to do the things I want to do in a sustainable way.
Yes. Okay. That makes sense. And it's interesting that you said ask questions to develop your own answers. It almost makes me seem like a part of therapy, like having the person develop their own, like you can't tell them what to think, you can't tell them what to do. But can you talk a little bit more of how is coaching different? This going to therapy, mentoring. There's so many different words I've
Sure,
thrown out there. Special about
absolutely.
coaching.
I think coaching is taking a person who is functioning already and helping them to up level to function even more how they desire to be. It's very much like taking stock of where you are now and where you want to be in many different areas of your life, or it could be one specific problem, or it could be general. I think a process of bit more solution focused, right? Like tangible solutions. There's definitely some drawing on the past, but not as much as in therapy. I feel like where you're starting in therapy with a diagnosis like you have anxiety, you have depression, you have this sort of label, reaching back into why those patterns developed and how they've come to be and what to do from there versus coaching. There's an awareness, layers of awareness, right? But it's more focused on not staying stuck and unpacking where you're at right now. It's about how can I? It's much more generative, imaginative. It just really expands your perspective, right? It just widens your lens in so many ways. The difference in coaching. And there's definitely niches with particular life coach decisions or parenting coaches or career coaches, right? There's very specific things that people seek help with. But I just feel like the coach offers a container for people to be able to explore where they are, where they want to be, why it matters to them, and then the path to helping them chart their own journey.
That is so interesting. Thank you so much for explaining that. I can definitely see how helpful that can be for individuals at different stages, whether that is a clear path of I want to get into this residency or I want a specific job, but can really be in all different wides. I think actually the first time I got to do coaching was at a American Women's Medical Association annual conference.
Oh,
They
cool.
only had a 15-minute block, and I talked with one of the coaches on my residency application. I wanted to go to residency, obviously, we all do, but
Yes.
my challenge was failing step. And so we talked about how we were going to talk about failing step, if that was actually a challenge or was I making it so much of a challenge in my own mind. I realized through that it was like a self, yes, there's society. It was a lot of separating of, okay, it happened in the past, but yeah, it's interesting.
Yeah. What are you going to do with that now? Or what's the
Yes.
story you tell yourself about that? I think is a lot of it
Mm,
too. Yeah. Because that subconsciously leads us to what we think we're capable of, what we think is possible for us. It's a
yeah.
lot of those like stories that we're maybe not aware of. So a lot of coaching is
Mhm.
like bringing awareness.
I get it. I see what you're saying. It was my own battles, my own limitations when maybe it wasn't actually a limitation. When you mentioned burnout, for all the physicians that are dealing with burnout, can you just talk a little bit about what that looked like, how you were able to manage? What did burnout really look like for you?
That is a good
Because it
question.
shows it differently in different people.
I think when I was in the deepest part of burnout, which was a few months into the pandemic, I just felt almost numb. I was moving through, doing the things. I was still showing up to work and seeing patients. I was coming home physically around my children, taking care of their needs, but I felt almost robotic. It was just a rinse and repeat. And I remember feeling, oh, another day. And I would have to psych myself up to go to work, to see each patient. It was trudging through mud. It didn't feel good, but at the time I remember thinking, I just have to get through. And that was the feeling I always had. I just have to get through this time, this next half a day or whatever, this week. There was always this moving goalpost to get through, but that was the thing I was measuring. It was like that idea of surviving but not thriving. And I just did not feel like myself. I didn't feel connected to myself. I didn't feel like there was a lot of hope for improvement, I think was another thing. And I was just really sucked into this tornado of the work culture and everyone complaining all the time. And that was what I was in. And so that was what I experienced more of. It was just this, oh, all these things need to change in the system. It's so messed up. It's so broken. And parenting is so hard. And everything was just like a slog, is how I would best describe it. Like it seemed inconvenient. You know what I mean?
Yeah, I can imagine that grayness, that cloud. So, was coach like what came next in that period? How did you your next step forward?
Yeah. So I think the first coaching community I was part of, I had done some physician one on one coaching, like single sessions. Those were powerful in that even if I didn't have a tangible thing I was doing or changing, it opened me up to there is hope, there is possibility. Like it doesn't have to stay like this forever. The group coaching container I became a part of was for professional working moms, not necessarily physicians, but all types all over the country. I honestly think it was the community of showing up on these calls, talking with other women, hearing their stories, and the vulnerability that was created that powerful connection and sense of you're not alone. You're not crazy that this is happening to you. It makes sense that this is how you're feeling, and almost offered me that compassion for myself, which I didn't think I had. I thought I was doing something wrong, or I just needed to find a better system to meal plan and then family life would be easier. And that's not how it works.
I interviewed a psychiatrist and she said, we are in the profession of giving hope. And that kind of stuck with me, just that idea of when you're in that negativity, it seems to be a common thing of not having hope. Magical how just grabbing onto something, whether that is someone you love, building a community, just like you said, learning you're not alone is huge.
Yes, it really is. It's just really helpful within coaching as well with the community, because you can clarify, like you see parts of yourselves in others, right? And in their stories and their struggles. And I think that you can not only relate to them and encourage them, but you can also use each other as accountability. We are not stuck in this and we want better. We believe better is possible for us, whatever that looks like. We're acknowledging it and I think really validating one another, but then saying, and what do we do from here? What do we desire from here? And how do we hold each other accountable to make that happen? That's a really uncomfortable world to step into. Uncomfortable emotions come up, I think. And many of us are not taught to process those, especially in medicine. Head down, keep going, don't acknowledge weakness. I think there's a huge amount of relief and power of transformation when you are stepping into that space and being curious and open about what's possible.
I'm interested if going through this experience has impacted how you see patients or how you interact with patients at all. How is
Yes.
that translated in the professional lens?
Yeah. I feel like I'm able to be more authentically myself with patients. I think that's the biggest takeaway. Like I used to put on some facade of the power differential. I embrace that and be like, okay, they're looking to me as this expert and they need me to act a certain way and not admit if I don't know something. Palliative kind of strips away a lot of that because you're talking about things that are really challenging and people haven't shared. You have to develop a rapport pretty quickly to be able to get some of those deeper layers and to address some of those things, like knowing you have less than a year left. What's most important? That's not just something you share with anyone. And so I think it's like that rapport building and being able to demonstrate my own humanity with them is probably one of the biggest shifts that I've had in the last few years since I've been doing more coaching, and just that development of growth work is how I would say I show up differently with them.
That is beautiful. I would love to hear more because for people who we had talked about like personal disclosure before, does that show up at all in your practice
Sometimes,
now?
yeah. And I think in the journey of understanding myself and being able to check in with myself and ask what I need at that time, like in any given day, is something that helps guide me in that. There is a level of being able to relate and build rapport when you're able to talk about something in your own life or a personal reflection that you have, right, with your patients. But then there's times where you just don't have that capacity, or something feels too tender, too raw, and being able to discern that in the moment is the skill that I'm still working on, but I definitely think is something that I'm growing, and being able to recognize that for myself in the interaction and then honor that. Like I might have something that I could say and relate to the patient about, but sometimes it's just not the right time for me. And so I won't delve into that.
I
Okay.
like that you say that. Can you talk more about being able to discern when it's okay or when it's
Mhm.
not okay? Like for
Yeah.
your own, like even
I think that's a path that I'm learning as far as tuning in with my body, my own emotions, and my own energy. Some people will call it intuition, and I think there is wisdom in your body. But certainly, I've done a lot of work in understanding more about the nervous system regulation and knowing my own zones. Green means I'm calm, connected, present, and in that ability and capacity to connect without feeling that sense of urgency or kind of disconnection and shutdown. It's just about knowing my own body signals. Do I feel more open, expansive, like free, present, or do I notice my body and mind being more on like the got to get this done, got to knock this out kind of thing.
That's really helpful. Green, being able to, you're open, you're safe, your heart rate's down. Versus red, you're more maybe higher stress, panic, shutting down, your heart rate's beating more, you're maybe breathing faster. During my leave of absence from medical school, I did a certification in somatic trauma therapy. That is something that I try to bring, like the knowledge of our body and how we present that, and try to tune into that when we're talking with patients. We have our own ups and downs based on what the patient's saying. So I really loved what you said there. Even in trying to connect with the patient, you're in tune with your own body. That's phenomenal.
The skill of interoception, like noticing your body's signals.
Yes, I love that. Interoception, energy.
Sometimes people are really overwhelmed with how to start. How do I grow interoception? That seems very powerful, but what do I do about it? I always suggest the first one being like noticing your physiologic cues and attending to them, not delaying them. I'm sure that in residency training, you are conditioned to not pee or eat for hours and hours. There's a tendency for us to be like, I'm just going to finish this note or these other tasks. But to notice it, be like, I have to pee. And then going to do it is going to build that skill with yourself and trust with yourself. It sounds simple and silly, but it's like my body has a need and I'm noticing it and doing something about it, right? Getting that snack, getting that water, not putting yourself off and living from like neck up in our thinking brains.
Amazing. That will be really helpful for people. You gave very tangible ways. It is hard. We're in a society where we learn, and you're talking about in medicine, a complete society, a community of our bodies don't matter. We have to be brain and attention. Like we have to be as far separated from our own needs as possible.
Right. For sure.
I love that. As we start to close off, you said so many amazing things, but do you have any final pearls of wisdom or advice for other health professionals who maybe are struggling with burnout, health conditions, or even disabilities?
Imagine the possibility for yourself that wherever you are, and whatever's a struggle for you, ongoing issues that you're just like, these are really horrible. And they don't feel like I've tried a lot of things to change and it doesn't feel like I'm getting any traction. I would just encourage people to not close themselves off from discovering more or being curious about whether or not there's something they haven't tapped into. Another idea is, in other words, we have a lot of limitations in what we think is possible or what we think it has to look like in any certain way. And I think there's always at least a handful, if not dozens of other ways that it could look.
That's amazing. I love that. And I can hear a little bit of that coaching in you of imagine a future where there are no challenges. Imagine that something's possible.
If you want to be a mom, have kids, and be a doctor, and you're like, I'm going to have to sacrifice, something's going to always be not well. It's like that, challenge that belief, right? Challenge it. Imagine what it looks like if you are in charge and you're driving your own boat of life, or whatever analogy you want to use. Truly, you have the power to create that. And I will say, speaking honestly, no one else is going to come do that for you. So if you want to create the life you desire, there's resources, tools, a lot of support, but you have to be the one to make that decision and believe that's possible for you.
I love that. Create the life you desire.
Yeah.
That's beautiful.
That's what I learn every day. It's like I'm solving my case every day.
Yeah, I wonder, I'd be interested how much that had impact when we push away death and don't think about it. But then if it's staring you right in the face every day at work, I'm sure it makes you think about how you're running your own life.
Like a clarifying filter of how to live well and what really matters. Like when you zoom out.
Yes. I love that. Thank you, Dr. Wittry, so much for sharing the ups and downs of your life and how you've made a life that you want. I always love to finish with just a summary of the things you said. So, you talked from your background, you started in a love for pediatrics, but then that seemed to shift during medical school. And then in residency, you went into PM&R and you start to notice how these life-changing diagnoses, being in interprofessional collaboration was really important to you. So that you decided to pursue a fellowship in palliative where you really got to have that emotional connection, listening to the stories, being really patient-centered is what it sounds like. And then all the challenges started to build up a little bit in your own life. And then with COVID and everything, you started to feel burnout, feel numbness, feel this decreased hope to your life. And it wasn't until you found coaching and a support group, being able to find hope again, connect with others, and be accountable with each other and learn to develop your own agency all the way to a point that you actually decided, you know what, I want to be a coach. I want to do that. You talked about how your personal growth then led you in the professional way of being able to be more present, physically present with patients and in your own body, able to recognize how and when do I feel able to connect? How do I connect? How can I bring my own personal reflections into this patient care relationship? And then you finish talking about how, as medical professionals that struggle, it's so important to really challenge that negativity, that pain, and imagine a world and possibility where your dreams actually come true of what you want is possible. And you said you deserve and create the life that you desire. I love that. So thank you, Dr. Wittry, so much.
Absolutely. I think it's awesome that you're sharing stories and the diversity of voices and different folks on their journeys. I think we can all learn so much from one another's stories and how their life experiences have shaped their choices and perspectives on things and what it means to keep working in medicine and also being a human.
You pretty much just summed up the reason I created this podcast. There's so much roboticness and less humanity in medicine. So really trying to reconnect that humanity through the person and the profession. And hearing, like you said, diverse voices, not just from people who've done it, who've gotten there as doctors, but also in the students, the residents, the people all in between. Stories are meaningful and important.
Right, absolutely.
If people want to learn more from you, I think I saw something. You definitely have a coach. So tell me how people can connect more with you and learn more.
Sure. So I'm on LinkedIn. Just search for my name, Sarah Wittry. I have a blog and a podcast that I do every week. So the podcast is called Vibrant Humans, and it's all things like personal, professional growth, particularly for working moms in medicine. And my website is Vibrant Humans, Sarah Wittry, all one word.com. I'm doing a 5-day micro habit challenge for more energy and improved mood for working professional women this summer. It's like July 8th to 12th, but it's just a little way to prioritize yourself, right? With like in a community of people who want to do the same and just take a fresh look and a fresh perspective at some of their habits and how they can use them to have improved well-being and energy as they're navigating all their different roles. So that's what I'm working on this summer.
Thank you, Dr. Wittry, so much. I like to end the podcast with just saying that you're not alone. We all struggle. Hopefully, you can see through these podcast episodes that each of us has personal challenges that we deal with, and just know that there's hope. Know that you're not alone, and know that it is possible to overcome said challenge. And so thank you, everyone, for listening in. If this is the first time, make sure to subscribe, but also share it with one other person that you think might resonate with someone, a friend or someone that you think this episode or podcast You can see more of the episodes on my website, medpsychmoss.com/podcast. You can see my blog with all my challenges in medical school, failing step, going through leave of absences, infertility, all the different things. So if you resonate with any of those, you can go to the blog. I look forward to seeing you all next time. Thank you, Dr. Wittry.
Thank you so much for having me. It was so fun.